Matthew, thanks for coming back to see me again. My name's Amanda and I'm going to be your dental hygiene student today. Today we're going to go ahead and recap what we talked about last time, and then we're going to talk about a few new things. Do you remember what we talked about last time?
Plaque and toothbrushing.
Very good. And do you remember what is plaque?
It's a soft, sticky bacteria.
Very true. It's a soft, sticky bacteria, and it likes to hide all over your mouth. So do you remember when we talked about toothbrushing, how often you need to brush and for how long?
About 2 times a day for right around 2 minutes.
Very good. And are we flossing every day?
I try to.
Okay, sounds good. Well, we're going to go ahead and talk about 2 new topics today. We're going to talk about periodontitis, and we're going to talk about proper flossing technique. I chose to talk about these 2 topics today because you have been diagnosed with periodontitis, and so I'd like to make sure that you have a full understanding, and then flossing is going to help halt the progression of that disease, so we're going to talk about that a little bit more later. Okay. All right, so how are you feeling? How are you doing with that toothbrushing technique we talked about last time, the modified Bass method?
Going good, I think.
Okay, good. It looks like from your assessment today, your plaque score went down to 2.4, which is now considered fair, and your bleeding score is 45%. So it looks like both of those scores went down, so that's good. We're headed in the right direction. So it looks like your toothbrushing is working at home. Okay, so today we have a few more goals for you. Our long-term goal is going to be to halt the progression of periodontitis by reducing your bleeding score to 0 by your next appointment in 6 months. And then our short-term goals will help us achieve the long-term goal. So our first one is going to be to understand what is periodontitis and what causes it. By the end of today's session, we're going to try to reduce your bleeding score by 20% at each visit, and we're going to demonstrate proper flossing technique and start flossing once a day starting today. Does that sound attainable to you?
Let's do it.
Okay, sounds good. So first I'm going to start off with, I've got a few questions on my slide here. Do you know what periodontitis is?
I have not the slightest clue.
Okay, sounds good. Well, I'm here to educate you. Periodontitis is a gum disease that includes inflammation of the periodontium, which is going to be your gums and then the bone as well, and the gingival tissue, the ligament, and all of the supporting tissues inside your mouth that keep your teeth in place. Periodontitis does include bone loss, which is what sets it apart from gingivitis. Do you know what the signs and symptoms of periodontitis might be?
No.
Okay, so a lot of times with periodontitis, we have bleeding gums, especially when we're brushing and flossing. Sometimes they'll just bleed on their own. Pain, discomfort, and tenderness, or they'll be red. You'll often get food stuck between your teeth. You could possibly have bad breath or chronic bad taste in your mouth, and then sometimes it can even make your teeth feel loose, or they might actually start to loosen up. Do you know what might cause that?
Not brushing or flossing?
Very true. If we don't brush twice a day for 2 minutes at a time and floss every day, that's going to lead to gingivitis, which then leads to the periodontitis with the bone loss. That is due to plaque bacteria. So we need to be making sure that we're getting all that plaque bacteria out of our mouths so that once we have this periodontitis, we have to stop the progression of the disease. Do you know if it's reversible or not?
I would assume no.
That's correct. That's a good assumption. It is not reversible, and that's because of the bone loss. Once the bone is gone, we can't regrow it back. So going ahead and learning how to properly floss to add to your Bass brushing method is going to help halt the progression of the disease and keep your mouth as healthy as it can be, so that way the periodontitis doesn't get worse. Okay, alrighty, and so we're going to go ahead and get ready to learn about flossing.
Let's learn away.
Okay.